So it's like 5:45 in the morning on Saturday. I have a 12-hour shift today. So I'm gonna try to take you guys throughout my day, kind of give you a glimpse into a day of a surgery student. So hopefully today is pretty interesting, but pretty chill, so I can get some studying done, but we shall see. So, did you switch with Russell? Did you switch with Russell?
No, she told me to come in.
Oh, for real? All right, so right now we're gonna look at some patient charts and then go do some pre-rounding before our resident comes in. So that should take about a good hour or so. So yeah. So I just ran to my car. It's raining outside, and I parked kind of far. I didn't bring an umbrella. I didn't think it was gonna rain today. But anyway, it's about 12:20 right now. So I've been at the hospital for about 6 hours. Went and rounded on a few patients. Then, well, pre-rounded on some patients. Then I went and rounded with the resident. And I went and saw a new consult. So now I'm gonna go grab us some lunch because it's my turn, I guess. And then come back, finish up some notes and some charting. Work on a PowerPoint presentation that I have to do on Wednesday. And yeah, see what else comes in. All right, so I just finished changing a couple wounds. Actually, there is a temporal artery biopsy that I'm going to go try to scrub into real quick. And then after that, there's an emergency exploratory laparotomy. We think the patient has a perforated bowel, so we're going to go ahead and see what's going on with that. I'm gonna explain a lot of these details at the end of the video, but for now, I'm gonna check up and read up on some of these procedures, and then I'm gonna scrub in. All right, so I just got done with a 15-hour shift. I'm so tired. I need to go get me something to eat. I gotta be back here at 6 a.m. tomorrow. It's 9 o'clock right now. So yeah, I'm gonna go get something to eat and then shower and then go to sleep. I might try to sneak in the episode of The Office, but we gonna see how that goes. All right, so right now it's like 9:40. I got me some food from Pee-wee. So I got this General Tso's bento box. It's like $10. Comes with sushi, salad, rice, General Tso's chicken, and some little chicken pot stickers. So yeah, my plan is to eat. I'll probably have to watch like 2 episodes of The Office so I can let my food digest, or else I'll be up with heartburn for a long time. As you can see, I'm pretty tired, but gotta get ready to go to bed and wake up in the morning so I can do this all over again. So what's up, guys? Today is Sunday, so I thought this would be a good spot to end the vlog. I actually filmed this footage like 2 weeks ago, and so I've been so busy that it's taken me 2 weeks to kind of summarize everything. So basically, that was pretty much like a 15-hour shift. The next day was only like 12 hours, so that was cool. But from the beginning to the bottom of the shift, I pretty much rounded with one of the residents, rounded with the attending, took care of a bunch of wounds. So we had like sacral ulcers, bedside debridements when you go in and kind of clean the wound out with different surgical equipment. What else did we do? Just a bunch of wounds. And then we did scrub into a couple of cases So the first case that I scrubbed in on was a bilateral temporal artery biopsy. And so basically they go and take branches of your temporal artery, and they take about 2 to 3 centimeters of it, and they send it to pathology to work with different differential diagnoses. So they were trying to rule out something called temporal arteritis, which is basically inflammation of your temporal artery, and it causes things like jaw claudication, you know, blindness, just different things. I don't want to get too complicated with that, but it was a pretty cool procedure. I always would read about it while I was studying, and so it was nice to see it up close and personal. What else did we do? We did an exploratory laparotomy, and so basically that's indicated when it's indicated when someone has like blunt or penetrating abdominal trauma, and it shows signs of peritonitis. So that means like the patient is guarding, and it's just like unbearable pain and a bunch of rigidity and just a bunch of different things that you have to be able to look out for. And so this patient had a bowel perforation. So an exploratory laparotomy, you'll make a midline incision in the abdomen, open everything up, move the fascia out the way, and pretty much just go through the bowel, trying to find where the perforation was, make sure you ligate that, take care of that. This patient actually ended up having adenocarcinoma, which is a cancer of the intestines. And so we actually end up doing a right-sided hemicolectomy, which means that you take part of the bowel, another part of the bowel, cut it, right, and then anastomose it together so it'll make a single connection. And so that was pretty cool. I've been scrubbed in on a couple of those, and a bunch of different surgeries that I've been able to scrub in on. It's been really cool experience. I myself personally am not considering surgery. However, I do work at a level 1 trauma center, so I get to see a lot of the traumas come in and out. And if you paid attention to my previous videos, I'm really interested in emergency medicine. So I get to talk to the emergency medicine resident, and he gives me some tips and pointers and stuff. And I get to just sort of see how a trauma is assessed on a day-to-day basis. So that's pretty cool. Yeah, so basically that's pretty much it. I've just been studying and working. I actually got an A+ on my last shelf exam, so that's cool. So I'm gonna kind of keep the same way I've been studying for my shelves, the same. Basically, I use Online MedEd, UWorld, Firecracker, and that's pretty much it. I do some outsourcing with my reading just to kind of brush up on things and stay ahead. But like I said, I'll make a different video for you guys looking to sort of see how to really study for shelf exams. So that'll be coming soon. But you know, you guys know I've been pretty backed up. It took me 2 weeks to finish this video. So I promise I'm going to try to get to those videos that y'all been asking for. It's just like third year is hectic, man. It's hectic. A lot is expected of you. You work these long hours, then you're expected to study as well. And so, you know, between that and trying to live my life and exercise and you know, just stay healthy and maintain a little bit of a social life, it's been kind of a working balance. So yeah, that's pretty much it for this video. Hope you guys enjoy. If you have any questions, any comments, any content that you want uploaded, make sure you drop it down below in the comment box below. I promise I'm going to try to get to them. See you guys on the next episode.